Have you ever noticed rough, scaly patches on your skin that just won't go away? These could be more than just dry skin. They might be actinic keratosis. Today, we're diving into what you need to know about this very common skin condition, how to recognize it, and why it matters for your skin health. Welcome back. I'm Dr. Maria Azizian, a board-certified general surgeon and IFM-certified functional medicine physician. On this channel, we talk about skin health, functional medicine, supplements, healthy and unhealthy foods, and the latest medical research. And if that sounds good, please don't forget to like, share, and subscribe. So what is actinic keratosis? Actinic keratosis is a mildly precancerous condition. What it means that in some cases, it may just go away by itself. So you may have it, for example, during the summer, and then come winter, when there is less sun exposure, these spots of actinic keratosis go away. And that, of course, gives you a clue that the main cause for actinic keratosis is sun damage or UV damage. So the next scenario is when those spots of actinic keratosis sort of stay the same for a long time. They just don't change. And finally, in some cases, some spots of actinic keratosis may turn into squamous cell cancer. Usually for one spot, the rate of this transition is 10%. However, in many people, I would say probably most people with actinic keratosis, they have more than one spot. So cumulatively, the transition rate is much higher. In our clinic, I usually say it's not every second, it's every 1.5 patient that we see over the age of 40 who actually has actinic keratosis. It's extremely common condition. So where does it occur? Which parts of the body does it affect? So first of all, of course, it occurs on the areas of the body that are always exposed to the sun. So that's our face. And don't forget the ears, because we see tons of actinic keratosis on the ears that actually very quickly, in some cases, turn into squamous cell cancer. The other area is scalp in men who are bald. And especially if you have a small balding spot, don't ignore it. Don't forget to apply sunscreen to that area, because that small balding spot can harbor many lesions of actinic keratosis, and we unfortunately do see that. And then we have forearms and hands. Additionally, in some cases, in women, probably a little more than in men, we do see actinic keratosis on the upper chest. So what does this look like? How do these spots of actinic keratosis present? A lot of times they are scaly and pink, and they could be even flat, and in some cases they could be very slightly indented. But in many cases, especially in advanced actinic keratosis, there is a raised component, as we call it, hypertrophic component, that is whitish or yellowish. And sometimes this hypertrophic component could be very firm, very hard, and though almost, as we call it, horn-like. It's like literally like a horn. And on that topic, you can have one or two of these spots, or you can have multiple. You can have a cluster of them. How do they present in terms of symptoms? Symptoms are important because in some cases it could be completely asymptomatic, especially if it's an early lesion or if it's a flat lesion. In some other cases, they could be itchy, and sometimes they actually could be painful, especially to touch. Let's say a person would describe that they're washing their face, and every time they wash it or they scrub their face in that area where the spot is, it's tender, it's unpleasant. And also a common theme is bleeding. Bleeding is always very concerning, because when somebody discusses that a spot or recalls that their spot bleeds, that makes you worry about the fact that it may have already transitioned into cancer. Precancerous spots can bleed too, so actinic keratosis can bleed too, but of course we see more bleeding, especially unprovoked bleeding. We see more of that with cancer, so that's a very concerning symptom. So, and then what is the age cutoff? So the age cutoff is about 40 years old, although we do see younger patients like in their 30s with a few of actinic keratosis. But the older we get, unfortunately, the more we're prone to these spots, because a lot of it is cumulative. So lifelong exposure to the sun does matter in terms of developing these actinic keratosis. in your older years. What are the certain factors that would predispose one to actinic keratosis? Number one, and very important one, is fair skin. People with lighter complexion are more prone to it, but I do have to say that if you have a darker complexion, it's more likely to be missed because it's less expected. And also, as I described, that usually it's pink. That's usually in the lighter skin people, but in darker skin people, it actually could be more pigmented and it could look just like a brown spot. So it should not be ignored and it should be examined by your doctor. So all of the spots should be examined during the skin check. So a lighter complexion is very important factor. The other one is history of sunburns or a sunburn, because sometimes it may take just one bad sunburn to predispose you to these precancerous spots later in life. So that's important. Then, of course, outdoor exposure. Here on Cape Cod, we have lots of sailors, and of course, that's more prominent in this group, or in general, in people who are landscapers or just like to work outdoors. It's more common just because they're more exposed to the sun. And also people who live in warmer climate, sunny climate, or live at higher altitude. That's also common. And just to reiterate again, yes, increasing age, getting older is a factor that does predispose you to actinic keratosis. So how do we treat that? So in terms of the treatment, the first treatment that is usually done is cryotherapy, which is freezing with liquid nitrogen. And it's a great treatment because it's fast and it does eradicate the spot usually within a few weeks. And the cryotherapy is geared towards the removal of the superficial layer of the skin, which is perfect for this precancerous spot. So the second treatment that we use sometimes is a topical treatment with creams such as a chemotherapy agent, such as, for example, 5-fluorouracil. And that is more unpleasant treatment, I would say. Usually it's used for the areas of diffuse actinic keratosis. So it's usually not for one or two spots. It's usually for somebody with a bunch of red spots, as we call it, golfer's face, because again, people who play golf are very prone to that, and somebody who has them all over and you can't really freeze all of these spots, or freezing is not sufficient. So then I prescribe this cream, and unfortunately, it is very unpleasant for the patient because what this cream does, it chemically eats that diseased or superficial layer of the skin. And it's very unpleasant because your skin becomes very excoriated. Sometimes it can bleed. It's not a fun time for the patient, I have to say. So we use it for more advanced or more diffuse cases. Another treatment modality that is used a lot is photodynamic therapy. And that's a nice treatment because although it is a diffuse treatment, it's treatment of the light that kills off that superficial or burns that superficial layer of the skin. It does have repercussion in terms of the red skin for just a few days, or let's say for up to a week or two after the treatment, but it's less harsh than a topical treatment. Although there are outliers, some people do very well with the topical chemotherapy agent, and some people actually feel that a photodynamic therapy may be harsh as well. So there are outliers everywhere, but usually photodynamic therapy, I found it a little bit to be gentler than chemotherapy agent topical treatment. The last one is minor surgery, so removal of the spot. And why would we do that? Because some of these actinic keratosis could be too hard, too firm, and you know that no topical agent or no cryotherapy can take it away. So for that, it's just easier to surgically remove that. However, the best treatment is prevention. Number one prevention is to be diligent with sunscreen. So we do recommend sunscreen with SPF at least 30. Sunscreen should be used in summer and in winter. It should be used all year round. However, in the winter, we only recommend it on the face, ears, and if your scalp is exposed, on your scalp. Please don't forget to do that. And in the summer and warmer months, once a day is not enough, then please reapply after you have been in the sun for 60 to 90 minutes or more. It's very important. Number 2 is, of course, preventative measures such as UV protective clothing, also hats, also sunglasses. So that's very, very important. Number 3, try to stay away from sun, especially in the summer, in the hours from 10 a.m. to 4 p.m. because that's when the sun is the strongest. And the last one, please keep up with your skin checks because a lot of times these spots could be in their early stages and it's so much easier to treat them before they become more raised and more painful and more symptomatic. I hope this has been helpful. I'm looking forward to reading your comments. Thank you so much for watching. Until next time, bye-bye.